So what is pseudogout? You have calcium pyrophosphate, CPPD, right? So a lot of people above the age of 60, you'll automatically have calcium pyrophosphate deposition in your body. The question is, what if a younger person below the age of 60 develops, comes with a joint like a knee swelling, and you see, hey, this could be pseudogout. So when you think of pseudogout, when you tap that joint, what kind of crystal would you see there? Rhomboid. And the important thing is this positively bifringent or negative? Positive. Whereas gout, it was negatively bifringent. What does that mean?
Rotate
the light, right? So the way to remember, in gout, parallel, which has two L's, it'll look yellow. If you do perpendicular, it would look blue. If that pattern exists, you call it negatively bifringent, which is for gout. And for pseudogout, it's the opposite. Okay, it's rhomboid shaped. Now, if somebody, young person, develops pseudogout, okay, what are the conditions you should think about in those patients or screen them for? Hemochromatosis, hyperparathyroidism, hypomagnesemia, hypothyroidism, and hypophosphatemia. And now they also have post-parathyroidectomy. So we can make it total 6, I suppose. Hemochromatosis, hyperpara, hypothyroid, hypomagnesemia, hypophosphatemia, and post-parathyroidectomy. So 6. Those are the first 6 things you want to look for in your patient with pseudogout. How do you treat an acute pseudogout episode? Again, it lasts longer than gout, more than 3 weeks. And it typically affects your knee joint. Just based on that, you'll be able to diagnose most of the time. Acute treatment is exactly the same as acute gout, right? So you'll treat it colchicine, NSAIDs, or steroids. What about chronic treatment? There's no drug to prevent the formation of pseudogout or calcium pyrophosphate. There's nothing. So when it comes to chronic, you kind of play with colchicine. Thank you for watching. If you like our content, please like this video, subscribe to our channel, and hit the bell icon so you get notified when a video is released every week. Have fun studying. We'll see you on the next one.